Hi, I'm Odion Binitie, and I'm an orthopedic oncologist in the Department of Sarcoma. Sarcomas or cancers as a whole in young patients are pretty rare, and so it's important for these patients to be taken care of at specialized hospitals. And the expertise we have at Moffitt with the orthopedic oncologists, our surgical oncologists, and our medical oncologists, several of us who have training in both pediatric and adult tumors, bring that expertise, which is pretty rare. The ability to take care of patients and fix acute problems, so fix a broken bone or repair a ligament that has been torn, attracted me to orthopedics to start off with, but then complementing that with cancer, being able to remove a tumor and have somebody walk the next day was exciting for me. Another influence is the fact that I'm also specialized in pediatric orthopedics, and so bringing in the pediatric patients is even more inspiring because then you have a young child that you can remove a tumor and take care of. One of the lines I tell most of my patients is, you did not get referred to Moffitt just because of me, but for the expertise of the whole center. And so Tumor Board is a perfect example of that even though I am their physician, but there's a group of physicians with me, behind me, in front of me that are helping take care of the patient. And so Tumor Board is a perfect example of us all working together for the one patient. I absolutely love taking care of my pediatric patients because kids just want to do well. And for the patients who are too young to even speak or make a coherent sentence, for them, they just think there's something wrong with their leg and they want it to go away so they can go back to playing. I think they have a lot more courage than a lot of my adult patients do. They almost have that nothing can stop them kind of mentality. And a lot of times, get courage from my patients, and especially my young patients, pediatric and the adolescent and young adult patients, just with that drive to want to get better. And so I think the courage I get is wanting to be the best that I can for the patient first of all, and obviously their parents. Nobody can determine the future or what will happen, but it's my job, it's my calling, I guess, to be able to help the patient and their parents along that path. I do think it does take some courage to walk in every day, to have to face patients who have cancer, sometimes delivering bad news. But obviously reveling in when you're able to give good news, or when a patient comes back 5 years after their diagnosis and have been cancer-free. And so I definitely think there is courage. And so for the staff and faculty and doctors who work at Moffitt, I think that's inherent in their personalities and what they do.